HOCM stands for hypertrophic obstructive cardiomyopathy. It is a genetic disease of the heart muscle in which the heart muscle becomes unduly thickened and causes obstruction to outflow of blood from the left ventricle. Left ventricle is the lower left chamber of the heart which pumps blood to the whole body. So far, HOCM was being treated with medications like beta blockers, some types of calcium channel blockers, and disopyramide. These drugs reduce the force of contraction of the left ventricle. Mavacamten is a first-in-class drug which inhibits cardiac myosin, a protein required for heart muscle contraction. US FDA has approved Mavacamten for adults with symptomatic HOCM to improve exercise capacity and symptoms. The approval is for those in New York Heart Association functional class 2 or 3, which would mean those with mild to moderate symptoms. That also means it is not meant for the most symptomatic persons in class 4 and those without symptoms in class 1. The medication has been designated as breakthrough therapy for the specified treatment. An important safety information mentioned by US FDA is the possibility of heart failure, which is more likely in those with intercurrent infection or heart rhythm abnormalities like atrial fibrillation with fast ventricular rate. Atrial fibrillation is a fast, irregular rhythm originating from the upper chambers of the heart and can worsen the functional status in HOCM. They suggested monitoring with echocardiogram to assess heart function. Echocardiogram is ultrasound study of the heart. Here is a color Doppler echocardiogram in a case of hypertrophic obstructive cardiomyopathy. It shows the gross thickening of the interventricular septum between the right and left ventricles, obstruction to outflow of blood from the left ventricle, and leak in the mitral valve. Mitral valve is the valve between the left upper and lower chambers. RV, right ventricle, LV, left ventricle, IVS, interventricular septum, LVOT, left ventricular outflow tract, AML, anterior mitral leaflet, SAM, systolic anterior motion of mitral valve, AOV, aortic valve. Possibility of drug interactions with certain prescription and over-the-counter drugs which interfere with the metabolism of Mavacamten have also been highlighted. Due to the risk of heart failure, Mavacamten is available only through a risk evaluation and mitigation strategy (REMS) to ensure safe use by lowering the risk of heart failure. Use along with certain medications is to be avoided, and close monitoring has been recommended in case of some medications. Most important monitoring is serial assessment of the pumping function of the heart, typically by echocardiography. As of early 2026, Mavacamten is a fully approved first-in-class cardiac myosin inhibitor. It is widely authorized for use in over 50 countries across 5 continents. Its current regulatory and clinical status is summarized below. Mavacamten is approved for the treatment of adults with symptomatic New York Heart Association NYHA class 2 to 3 hypertrophic obstructive cardiomyopathy HOCM. The goal is to improve functional capacity, reduce left ventricular outflow tract or LVOT obstruction, and alleviate symptoms like shortness of breath and fatigue. United States Food and Drug Administration originally approved Mavacamten in April 2022. As of April 2025, the FDA updated the label to reduce echocardiography monitoring requirements, making the treatment slightly less burdensome for patients while maintaining safety. European Union approved it in mid-2023. It remains as an authorized therapy across the European Union for adult HOCM. It has also received approvals in major markets including Canada, Australia, Brazil, Switzerland, and China. On January 12, 2026, positive phase 3 results from SCOUT HCM trial has been announced. This study showed that Mavacamten significantly reduced LVOT obstruction in adolescents aged 12 to less than 18 years. While not yet fully approved for this age group, these results support an upcoming regulatory filing to expand the indication to younger patients. As of January 2026, Mavacamten is no longer the only drug in its class. A second cardiac myosin inhibitor, Mavacamten, received FDA approval in late December 2025, providing a new alternative for HOCM patients. Because Mavacamten works by reducing heart muscle contraction, it carries a risk of heart failure if the left ventricular ejection fraction LVEF drops too low. In the US, it is only available through the REMS, Risk Evaluation and Mitigation Strategy program. Patients must undergo regular echocardiograms to monitor heart function and ensures the dosage is safe. Monitoring for interactions with cytochrome P2C19 and 3A4 inhibitors or inducers is critical, as these can significantly affect the drug's level in blood.